Good afternoon, everyone. My name is Inge Loendom Sonda, Adolescent and Young Person Coordinator from Mopani. Welcome to yet another live show, Friday live show by the ZYP Zambia Youth Platform. I am your guest, and with me in the studio we have Anna Miambo and Shadrick Chansa, our language interpreter, a sign language interpreter. Anna Miambo is a registered nurse and midwife from PPAZ. On today's show, we're going to talk about the effects of abusing or misusing emergency contraceptions and also other contraceptions. Over to you, Anna.
Hello, good afternoon, everyone. Thank you for joining us for another show today, Friday. So today we're mainly going to talk about emergency contraceptives, the effects of abusing emergency contraceptives, which is commonly known as the morning after pill. So first thing, what is an emergency contraceptive? So an emergency contraceptive is a form of contraception that you can use after having unprotected intercourse where you suspect that you might get pregnant or to avoid pregnancy, or in situations where maybe you are already on another contraceptive but you suspect maybe there might be some form of contraception failure. So we have mainly two types of emergency contraceptives. So we have the one that is commonly used, which contains one hormone. So that one is easily accessible over the counter. So there are two types. There's one that has one pill, and then there's the other one that has two pills. So these contraceptives have to be taken within 72 hours after having unprotected sex. So the other form is an intrauterine device, contraceptive device, commonly known as an IUD. So this one is inserted in the uterus through the vagina, cervix. That's the process. So that one can be inserted even up to 6 days after having unprotected sex. Okay. Anything to add on, Inge?
Okay, so these emergency contraceptives, you might be wondering how they work. So the emergency contraceptives work by delaying or inhibiting ovulation. It thickens one's cervical mucus, and the sperm is unable to flow to the uterine cavity where it implants with the egg. So when the mucus is thick, the sperm will be unable to flow um, to implant to the egg to form a baby. So that's how it works. These emergency contraceptives can't protect anyone from contracting HIV or any other STIs. So that's why we encourage people who are using emergency contraceptives to also use to also think of other things like using condoms before using these emergency contraceptives, because condoms are able to prevent both STIs and pregnancy. Um, I think Anna can talk about if taking multiple contraceptives can help or work more effectively. Anna, what do you think? If maybe I feel like I had sex and I take maybe two pills, it will work better. Do you think that's okay?
Okay, so emergency contraceptives, especially the pills, work effectively if you're not close to ovulating. So, in a case where somebody is already ovulating, the pills do not work. So, that's why sometimes we advise that even if you can access certain things over the counter, it's best to just seek medical advice so that you can be advised on which one you can take. So, it doesn't mean you taking more emergency contraceptive pills will increase the effectiveness. Sometimes it actually won't even work. It's not going to work at all. So the best way is, especially if you are not so sure about your cycle, at what point you are, and you feel like you might get pregnant, it's best you go to a clinic, to a hospital, so that you can be examined, they take some history, then they'll be able to help you or assist you on which emergency contraceptive is best amongst the two. So, to add on, emergency contraceptives are not advised to use frequently. So even just from the name, it's just supposed to be used in an emergency. So this is something that you're not supposed to frequently use. If you use it maybe today and then you're supposed to maybe ovulate in the next 1 week plus, it would definitely work. But if you take another pill again, it might not work. So if you know you are sexually active, it's best you go to a clinic or hospital, find out the type of contraceptives that they have, the side effects, and choose what you think is best for you that can work. So maybe some people don't like trying out these contraceptives because of the myths and misconceptions about contraceptives. So contraceptives can be used by anyone as long as they're sexually active, and it's not going to affect your fertility in future. Even if some of these contraceptives, even if some of these contraceptives actually make your periods disappear, but it doesn't mean even in future you're not going to have children. So what's actually going to happen if you abuse these emergency contraceptives, especially the pills? It's going to affect your cycle. You're going to have hormonal imbalance because it mainly works by delaying ovulation. So now, if you keep on postponing like that, it means you might disturb your cycle, and depending with how your body responds to hormonal changes, that is what is going to determine how fast or how soon your cycle is going to return to normal. So there are no major side effects that an emergency pill can cause, like maybe even affecting your fertility. But mainly, it's just going to mess up your cycle. So, Inge, What do you think about these emergency contraceptives? Do you think that they can affect someone's fertility? What do you think?
Okay, thank you, Anna. From what you said, if used correctly, they can't affect someone's fertility, but any drug, if abused, can affect someone's well-being. We're talking about
Yes.
drugs and hormones and all. So, from my understanding and my learning, emergency contraceptives, when taken in bulk, like in a large number, abused, if abused, can cause atrophy of the lining of the uterus. Atrophy simply means wearing off. So if the lining of the uterus wears off, maybe you might predispose yourself to having miscarriages in future and stuff like that. I had a friend in college who would use these emergency contraceptives every time they meet with the boyfriend, like every time, like every day, every week. So like we didn't know the effects then, but as of now she's been having multiple miscarriages, and from what I studied, I learned that abusing anything in excess, like using something in excess, is not okay. So if you want contraceptions, if you are engaging in sexual activities that might get you pregnant, I feel you choose a right contraceptive for you. An adolescent is free to get contraceptions. A youth is free to get contraceptions at the facilities around you. You can get anything that best suits you and get medical help from wherever you go. You'll be able to be assisted. Anna, what long-term
Yes.
effects, other long-term effects do you think contraceptions can cause, apart from maybe acne or these bleeding tendencies that people get, like you have irregular periods and nausea and other? What long-term effects do you feel people can get from abusing emergency contraceptives?
Okay. So I think you've talked about most of the side effects. So the one that people should just really worry about is uterine atrophy. So that one is going to affect you permanently, because if there's uterine atrophy, it means there's nowhere that fertilized egg can implant itself. So it would definitely what lead to an abortion, a miscarriage. And each time you get pregnant, you will just be having miscarriages. So it's very important that if you know you're sexually active and you cannot use condoms consistently, it's best you just choose a contraceptive that is going to work for you, that you feel is comfortable for you. Because amongst contraceptives, we have long acting but are reversible. And then on the short terms, sometimes depending with how long you are on those short term ones, especially the injections, it might take some time for your cycle to return, but we can help with that. You can actually take something to help your periods come back. So if you need more information, if you need more help on contraception that you can choose, just go to any clinic. And as youths, most of you shun away from accessing these services because you feel like people are going to not attend to you, they might judge you for having intercourse. But in these hospitals, clinics nowadays, there are youth friendly corners, spaces where you can go talk to someone and that person can at least help you or link you to somebody who might be able to help you. So it's best you have the accurate information about these contraceptives so that you make the right choices. And the best thing that you can do as a youth, it's best you just use um, barriers. You just use condoms. Condoms are the best because they will protect you from unwanted and planned pregnancies, and they'll also protect you against sexually transmitted infections. Because an emergency pill will just prevent pregnancy, and it ends there. But what about these other things that you are exposed to that you're likely to contract because of unprotected intercourse? Okay, anything else,
Okay.
Inge?
So even as we seek these services and these facilities, we know that we are engaging in life sex, right? So in as much as we engage in life sex, just like Anna said, let's screen for STIs. Let's screen for STIs. Sexually transmitted infections might not show just there and then after sleeping with someone, no. But you are worried about pregnancy. What of your health? What are the benefits of screening for HIV and other STIs? So, as you seek these services, let's screen for STIs. And also, there are also contraceptions, not emergency contraception, but other contraceptives like long acting, like the 3 months ones that give you a primary infertility. Like by primary infertility, I mean just a short term infertility. So if you misuse those, like you use those for long term, you might have difficulties falling pregnant maybe when you get pregnant. And also, let's also get some time to learn about different types of contraceptions that are there so that you choose which one will give you a good future out of it. Yeah. So I think that's all we had on emergency contraceptives. We are waiting for questions from you people. Let's engage in this topic. It's a very interesting topic. So we have a question from Bundani Cleven Zigambo. Is it true that contraceptives are used in treatment and prevention of ovarian cysts? Is it true that contraceptives are used in treatment and prevention of ovarian cysts? Anna, do you want to take this up?
Okay. Um, so at some point, one thing I've come to understand is at some point, every woman actually has or suffers from an ovarian cyst. But with some people, it actually becomes severe. Maybe they've had infections that have been long term and have gone untreated. So, the best treatment for an ovarian cyst is antibiotics. Because for that inflammation to happen, it means there's an infection. So, it's antibiotics. So, in contraceptives, we treat hormonal imbalance using the oral combined contraceptive pills, which have two hormones, progesterone and estrogen. And these hormones are the ones that mainly help with ovulation and menstruation. So those are the ones that we use. So sometimes if someone has an ovarian cyst, they what? Stop ovulating. So we give antibiotics. Then from there, if someone is not improving, maybe the issue might be they probably have a hormonal imbalance, meaning they don't have the production of hormones is not normal, so meaning they do not ovulate. So contraceptives, mostly just the pills, are used to correct hormonal imbalances. Ovarian cysts, we use antibiotics. And usually, when a woman is ovulating, when the egg is released, what remains sometimes might appear as an ovarian cyst. So, depending at what point you do a scan, sometimes when you do a scan, it will show that you have an ovarian cyst when actually it's not an ovarian cyst. But if you are in a lot of pain and it's not going away even after treatment and all that, just go back so that further tests can be done. And I also saw something there that long-term effects of abuse of contraceptives is infertility. So yes, that one by Fanny, that long-term abuse of contraception is infertility. So no, contraceptives do not cause permanent infertility. So like Inge said, it's just a temporal. Because if you look at contraceptives like the injections, those they have only one hormone, which is progesterone. So meaning there'll just be one hormone will be higher for some time. So there'll be no production of estrogen, which is responsible for ovulating. So the longer you use these contraceptives, the longer it will take for your cycle to return to normal. So sometimes that's what causes infertility. So if you know someone who's experiencing that, they can come through to our clinics. So PPSZ, we have clinics in Kitwe, Choma, Livingston, and Lusaka. So if you need help on that, if you've had such an encounter, we can actually help you to correct your cycle so that you can go back to normal. But it doesn't cause permanent infertility. Maybe there are just other underlying conditions which have caused that.
Okay, and
Okay.
also my appeal to everyone here. Okay, before I go to that, there's another question saying, is it safe to use a morning after more than 2 times a month? Is it safe to use a morning after more than 2 times a month? My answer here is it is safe to use a morning after more than 2 times a month. But as you use it, just know that in future you might develop atrophy of the uterine lining. That's what I talked about like earlier on. So be cautious. Let's not abuse these things because they're there. Um, if you feel like you'll be engaging in sex several times, make sure you just choose a contraception that best suits you, not relying on emergency contraceptives. You can use condoms, you can use the 3 months injection, the Depo-Provera, you can use any other contraceptions other than emergency contraceptions if you engage yourself in sexual activities more often. I hope I've answered your question. There's another question from Pro Hainsford. Do contraceptives only disturb menstrual cycle if abused or not? Do contraceptives only disturb menstrual cycle if abused or not? Hannah, can you take Pro's question?
Okay, do contraceptives only disturb menstrual cycle if abused or not? So yes, mostly because these contraceptives have these hormones that affects the menstrual cycle. So what you are using are artificial hormones to help you not get pregnant. So and they work by okay, so like emergency contraceptives, you are there is the what is the progesterone which is there. So meaning if progesterone will be high, what is delaying estrogen from coming in, which is responsible for ovulation. So it's just mainly with the menstrual cycle, and like if you use it for a long time, uterine atrophy. So that's just mainly the side effect.
I
Any
hope
other
it answers.
questions?
Okay, so Mark Seconda Hebrews is asking, what side effects does the morning after pill possess? What side effects does the morning after pill possess? The major side effects, the immediate side effects may include nausea, bleeding tendencies like an irregular menstrual period, and also acne because we're dealing with hormones here. So acne, nausea, irregular periods. You can also get maybe vomiting and all those side effects that come with menses. But there are no major side effects. These are the intermediate ones, and also the long term one, which we talked about, the atrophy of the uterine lining. So, those are the major side effects if abused. Pro Hainsford is also asking, why is it that most health practitioners don't take contraceptives? Why is it that most health practitioners don't take contraceptives? Well, for me, I think we'll answer it both with Anna because we're both I'm a clinical officer by profession, and I take contraceptives. Yeah. So it depends. I don't know where you got your data from, but I've seen a lot of health practitioners taking contraceptives, and maybe it's because we've learned how to like how our cycles. We've learned how to what is prevent pregnancy. I mean, we've been at school to learn those things. So I think maybe that's why you don't find a lot of them taking. Maybe they're using condoms, maybe they're using the withdrawal, maybe they are abstaining. Yeah, there are other methods of hindering pregnancy. Yeah, so for me, I'm a medical practitioner and I do take contraceptives. Anna.
Okay, so we do actually take contraceptives, but some people think we don't, but we actually do. So, what's just important is since we have this knowledge about contraceptives, we always go for what we feel is going to work best for our bodies. So, like for example, if I'm hypertensive, there's issue of hypertension in my family, and myself, maybe previous pregnancy, I cannot use something as the oral combined pill because it's contraindicated. So that's not going to be an option for me. I'll choose something else. I'll probably go for the IUD, the IOCD, which is non hormonal. So it's all about you finding out about the choices. And even as we give you these contraceptives, we'll take history and advise, okay, so since you have this condition, you cannot take this. You can we can recommend and you can make a choice. But health practitioners do take contraceptives. Personally, I do take these contraceptives.
Okay, it's been a very interesting topic, and I would advise people I've really appreciated your questions, and from what I've noticed from the last question, I would advise people really incline themselves to learning more about these things because they're very key and important. Uh, the friendly spaces, like Anna mentioned, in the facilities where you can access sexual reproductive health information. People go around in schools teaching about these things, in colleges, universities. So it's been a lovely afternoon. If you've got any questions, feel free to post on the live show stream on Facebook and we'll get back to you. But for now, we'll be winding up. I don't know if you have anything, Anna, to say, but we've had a lovely interactive session. I love you guys.
All right. Bye.